Hi viewers and welcome back to the SL TV. This video was created from an article on our health website. I'll drop the link to the article in the description box. After watching, please ensure you like, share and subscribe, and do not forget to come back for more. See you soon.
Pregnancy is without a doubt one of life's most incredible journeys. But let's be real, it can also be filled with a ton of questions. Every new twinge, every little ache makes you wonder, is this normal? In this explainer, we're going to zero in on one of the most important things you can learn as an expectant parent: how to tell the difference between a totally normal symptom and a serious warning sign that means you need to get help fast.
So let me introduce you to Catherine. She's 6 months along, doing everything right. But one morning, completely out of the blue, while she's just trying to get her toddler ready for school, this killer headache just hits her. And then the room starts spinning. In that one scary moment, she remembers her doctor's words. And she thinks, oh no, is this it? Is this one of those warning signs?
That feeling of uncertainty Catherine had, it's something so many expecting parents go through. I mean, your body is doing something amazing, and yeah, that can come with being tired, some aches, and maybe some nausea. But how do you really know what's just a normal part of the process? And what's your body's way of telling you that you need to get something checked out? Okay, this is really the heart of it all. You see, a lot of symptoms are kind of on a spectrum. On one side, you've got your everyday pregnancy stuff. Some mild aches, a bit of nausea, feeling tired, totally normal. But you have to notice how when those symptoms get dialed way up, when a mild ache becomes severe pain, or just being tired turns into dizziness or actually fainting, that's when they cross a really important line. It's that huge shift in intensity that's often the real signal.
Now, the point of this isn't to make you anxious, not at all. It's actually the opposite. It's about empowering you. Knowing what to look for gives you the confidence to act, and act decisively, for your health and for your baby's health. It completely transforms that worry into action.
And this is exactly why that confidence is so crucial. Get this, one study found that only 37.5%, less than 4 out of 10 pregnant women, were actually aware of these warning signs. That's a really big knowledge gap, and it just shows you how vital it is to get this information out there, clear and simple.
So why does it matter so much? Well, these warning signs can pop up suddenly, with no heads up at all. Being able to spot one the second it happens means you can act immediately. And that speed, that can be the difference maker. It can prevent serious complications, and in some cases, it is literally life-saving.
So what exactly are these signs we're talking about? To make it a little easier, we've broken down the 12 most common red flags into 3 main groups. And the first one? It relates directly to what Catherine was going through. Our first category is all about signs related to your blood pressure and circulation. These can point to really serious conditions like preeclampsia, which is a dangerous high blood pressure disorder that Catherine ended up having, or something like anemia, where your body just doesn't have enough healthy red blood cells. So let's get specific. A severe headache that just won't quit. Any kind of blurred vision. Sudden puffiness or swelling in your hands and feet. Actually, Catherine remembered her feet looking bigger a couple days earlier. And of course, dizziness or feeling like you're going to faint. Any of these mean it's time to call a professional right away. All right, the next group of signs are those that have to do directly with your baby's well-being and their little world inside the womb. We're talking about things involving the placenta and amniotic fluid. I need you to really pay close attention here, because these are absolute red flags. Any vaginal bleeding, and I mean any, needs to be checked out immediately. Severe abdominal pain, and we're talking intense pain, not just some mild cramping. If you notice your baby's movements have slowed down or changed a lot, that could be a sign they're in distress. And any leaking fluid from the vagina could mean your water has broken. All of these demand urgent medical care. Okay, our last category covers signs that might point to a bigger issue, like a severe illness or another kind of complication that can affect your whole body when you're pregnant. This includes things like vomiting so much you can't even keep water down and you get dehydrated. A convulsion or a seizure is a major sign of eclampsia, which is a life-threatening complication. A high fever could mean you have a serious infection, and last, any real trouble breathing. You never, ever ignore that. Okay, so let's say you've recognized a potential warning sign. Now what? The most important thing is not to panic. Instead, you act with a clear head. Here is your super straightforward action plan. First, and most importantly, you have to act fast. Don't sit around and wait to see if it gets better. Call your doctor, your midwife, or emergency services. Be ready to tell them exactly what's going on, what the symptoms are, when they started, and how bad they feel. If you can, grab your health records and a list of any medicines you're on. And this part is huge. Do not try to take any medicine on your own. Let the professionals tell you what to do. And all of this brings us to the biggest takeaway here. Knowledge is a lifesaver. It really is. It's not just information, it's a powerful tool that you can use. Let's just circle back to Catherine's story to see what that looks like in the real world. Because Catherine had learned about the warning signs, she knew her headache and dizziness were not just a normal part of pregnancy. She acted right away, she got diagnosed with preeclampsia, and she received the urgent care that she and her baby needed. Her story shows it perfectly. Her knowledge led to her taking action, and that action led to a safe outcome. So now this information isn't just on a screen anymore. It's with you. The real question is, are you ready to trust your gut and act on it? As you go on your pregnancy journey, just remember that being prepared is your greatest strength.
Please subscribe.